Hello, welcome to Advancing Health Literacy, Improving Supportive Systems for Clinical Settings. This is the fourth video in a series of trainings brought to you by the New Haven HEAL Initiative. The New Haven HEAL Initiative aims to improve health outcomes for New Haven residents, to reduce COVID-related disparities, and to increase patient engagement in their healthcare. To refresh your memory, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. In our most recent training, we went over how to encourage questions, make action plans, help patients remember how and when to take their medicine, and get patient feedback. During today's training, we'll be going over a few tools you can use to improve supportive systems in the community. Tool number 18 is links to non-medical support. Limited health literacy affects not only patients' healthcare, but also other aspects of their lives. Linking patients with available community resources, such as assistance with transportation, food, employment, budgeting, and housing, helps patients attend to and maintain their health. Supporting patients in this way involves developing knowledge of the resources available in the community, directing patients to relevant resources, and following up to ensure that the connections were actually made. To use this tool, start by assessing each patient's needs and support system. Ask patients about things that may affect their ability to manage their health. You could ask a general question such as, is there anything in your daily life that makes it hard to take care of your health? Or you could ask questions addressing specific needs, such as, was it easy for you to get here today? Ask about and involve the patient's current support systems, such as family, friends, and social workers. Find out and record what role each member of the support system plays in the patient's care. Listen to what patients tell you about the challenges in their lives. Note the patient's non-medical challenges in their medical records. Identify your community resources. In many parts of the country, the United Way and Alliance of Information and Referral Systems can provide you with a phone number to call for information about the social services in your area. You can press 211 on your phone or access this resource on the internet. The Chamber of Commerce can also provide a list of community services. Establish linkages with community partners. Ask specific agencies to send pamphlets or to give a presentation at your practice. This provides staff with an opportunity to meet a contact person, as well as learn more about the agency's services and the referral process. Create a system for organizing resources. Have one person take responsibility for organizing and updating resources and helping patients get connected. Keep the resources up to date. Ask patients to let you know if they cannot reach a community resource. Establish a schedule for verifying whether resource information is still accurate. Connect patients with resources. Use a referral form to provide patients with essential information about recommended services. Be sure to follow up. Find out if the referral was completed by contacting the patient or the service provider. Certify a notary public. Select one person in the practice to become a notary public. This can help expedite completion of certain forms and eliminate an additional step for patients. You can also refer to tool number 1 for more information on supporting and following up on referrals. Track your progress. Test whether your resource list is up to date. Conduct a spot check of your medical records. Track how many referrals are made in a month, and then again, either in 2, 6, or 12 months after. You can also check the patient's charts 1 month later to see if the outcome of the referral has been documented. Tool number 19 is directing patients to medicine resources. Medicine is an important component of many patients' treatment regimens. Unfortunately, some patients may try to save money by going without their medicines or reducing the amount they take. Helping patients to access low-cost medicines can support them in taking their prescriptions as directed. Assess patients' ability to pay for their medicines. Ask patients directly about difficulty they may be having getting their medicines. Let patients know that you can help. Emphasize how important it is for them to take their medicines. Ask them to let you know if they have problems paying for medicines before they run out. Review the patient's insurance coverage. Everyone is now required to have health insurance. If patients are uninsured, help them access Connecticut's marketplace where they can apply for insurance, including Medicaid and subsidized insurance. For Medicare patients, make sure they have Part D. Patients can get help enrolling in Part D from the State Health Insurance Assistance Program. When referring patients to resources, follow up to make sure they have been able to connect. You can also explore insurers' mail order options as a way to save money. Connect patients with medicine assistance programs. Refer patients to assistance programs to connect them with low-cost medicines. Separate applications will be required for each medicine needed. Be prepared to provide patients with assistance in navigating sites and completing applications. A few examples of available assistance programs include Needy Meds, Partnership for Prescription Assistance, RX Assist, and RX Outreach. Select Care Benefits Network is a patient advocate agency working with low-income patients to help them obtain their medicines from pharmaceutical companies. This organization may help patients filling out their applications. Be sure to also look into local programs that may be able to help with financial assistance for patients. Track your progress. Track over time how many patients need assistance paying for their medicines and note the services the practice provided. Ask patients if they went without medicine or did not take their full dose because of paying for it. Note any changes that happen over time. Tool number 20 is connecting patients with literacy and math resources. Research has shown that clinicians have trouble identifying patients with limited health literacy skills. Patients are unlikely to mention limitations in their literacy or math skills unless you initiate a conversation about the issue. For these patients, referral to an adult learning center for literacy and math skill enhancement can be a life-changing event. Ask patients directly about their literacy skills. Using the DIRECT tool, developed by the American Medical Association, can make discussing reading difficulties with patients feel less awkward. You can use this tool by asking a series of questions. Start by asking about their difficulty with reading. Ask if the patient has an interest in improving their reading skills. Have referral information for adults and family literacy programs ready to give to those identified with reading difficulty. Ask everyone about their literacy skills. Let patients know it is your policy to ask everyone. Emphasize that low literacy is a common problem and they are not alone. Finally, take down barriers to joining literacy classes, such as helping with initial phone calls, having informational sessions at the clinic, and making follow-up contact with patients. Connect patients to literacy and math resources. Identify community resources and regularly update resource information. Obtain or create an easy-to-read handout with information about joining a literacy or math program. Ensure the instructions are easy to understand. Offer help with the referral. Ask staff to help the patient by making the initial phone call. Document the referral. Identify a way of documenting referrals to literacy and math programs in your medical records and train staff to document referrals consistently. Track your progress. If you have an electronic health record, you can generate a tracking report from the system. Note 5 literacy or math referrals you made. Check the medical record after 1 month to see if the outcome of the referral is documented. Tool number 21 is making referrals easy. Primary care practices refer patients to specialists, specialized healthcare clinicians, labs and screening facilities, and elsewhere. Making the referral process easy for patients increases the chances that they will follow through and that both you and the referral destination get all the information you need. Start by referring patients to clinicians who coordinate care with you. Identify, develop, and maintain relationships with clinicians to whom you refer patients, and that can make the referral process run smoothly. Try to establish formal referral agreements with key specialist groups and other clinicians. Referral agreements spell out mutual expectations and responsibilities, such as which patients are appropriate to refer, what information is needed before and after a referral, roles for both parties after the referral, and setting aside appointments for urgent care. Don't continue to refer patients to clinicians who do not send information back to you, don't provide timely appointments for your patients, or otherwise fail to coordinate care. Don't rely on patients to relay information. Share important information directly with the other office, such as the reason for the referral, pertinent medical history, and test results. Explore making electronic referrals. Provide a detailed referral to the other clinician that contains all the information needed. Get information sent directly back to you. Make sure you get a full report back before your patient's next visit with you. Consider language barriers. When making referrals for patients with limited English proficiency, identify clinicians who are language concordant or have interpreter services. Include information on your patient's language assistance needs when making a referral. Make sure the patient understands the reason for the referral. Explain why the patient needs to be seen by someone else and what might happen if he or she is not seen. In the case of tests, explain how you and the patient will use the information to diagnose, manage, or decide on treatments for health conditions. In the case of screenings, give a clear explanation of the risks and benefits. Ultimately, it's up to the patient as to whether or not to undergo any particular test or screening. Use the teach-back method and ask about and address any concerns or fears. Offer help with the referral. Ask patients if they would like your office to make the initial phone call. If staff members are making appointments for patients, make sure they first find out when the patients are available. Ask patients about transportation and other barriers to completing their referral. Discuss how they could overcome these barriers. Provide clear instructions. For some referrals, patients will need to prepare in advance, such as fasting or discontinuing a medicine. Provide easy-to-understand instructions verbally and in writing. Explain the referral process fully, such as how you and the other clinician will exchange information and when the patient should return to your office. Give clear oral and written directions to get to the referral location. Follow up on referrals. Confirm and document that the patient successfully completed the referral. Obtain information on the result of the referral and document it in the medical record. Make sure the patient receives the results of any tests or screenings, even normal results. Provide patients positive feedback for completing referrals. Let patients see how you use the information obtained from tests or specialist visits. If the patient has not completed the referral, reinforce that you feel the patient could benefit and review barriers. Determine whether the patient might need additional referrals. Get feedback from patients on the quality of care provided. Stop making referrals to places that consistently receive negative reports. This concludes today's training on improving supportive systems. Be sure to try these tools out. This training is brought to you by the New Haven Health Education and Literacy Initiative, led by the New Haven Health Department.